Statistics show 1 in 4 women over the age of 18 have episodes of leaking urine, but most are too embarrassed to talk about it or to seek treatment. So we're here to bring that subject out into the open with our HCA partner, Dr. Megan Sneed from Lee Summit Women's Care. Thank you for coming in.
Thank you for having me.
I do think that this is a topic that many people think just comes with age.
Absolutely.
Just accept it and move on.
Absolutely.
And that's not the case.
No, it's absolutely not the case. In fact, I'll tell you the biggest thing that I notice is many women never say anything to their doctors about it. In fact, I'll almost get through an entire annual exam with a patient and just happen to mention at the end of the exam, do you leak urine when you cough or sneeze? And the vast majority of those women will say, oh, well, yeah, but just the normal amount for my age and since I've had babies. And I think that we often confuse common for normal. And even though urinary incontinence is very, very common, it's absolutely not normal at any age.
And we don't have to just put up with it.
Absolutely not. There are treatments for all types of incontinence.
Okay, so we'll get to those treatments here in a second. Let's first talk about some of the reasons why. I know there's a whole long list of reasons you might have a temporary issue with it. Alcohol, overhydration, caffeine, things that probably come and go in your life. But let's talk about these more persistent problems with urinary incontinence. Why might they come on in our bodies?
Well, many women will develop incontinence just as they age. Gaining weight, smoking weakens all of the tissues in our body, and so it will also weaken the pelvic floor and increase the risk of incontinence. The big one is having babies. We all know that vaginal deliveries increases your chance of leaking urine later in life. But what people don't realize is just having those pregnancies, carrying that baby for 40 weeks, can also put pressure on the pelvic floor and can increase your chances of having incontinence later in life, even if you don't have a vaginal delivery, even if you have a C-section.
Okay, so now let's talk about treatments and different things that can be done. There's a whole list of things.
Sure. Well,
where do you
there are
begin?
Different types of incontinence, and the two biggest ones are urgency incontinence, which is that gotta go, gotta go, gotta go. That where you feel like you have to pee really bad, and you may or may not actually make it to the bathroom. And that type of incontinence is treated with bladder retraining, some pelvic floor physical therapy, some biofeedback, medications like Detrol, Ditropin, those kind of things help with that kind of incontinence. The second really big one is stress incontinence, and that's the leaking urine with coughing, sneezing, running, jumping, laughing, those sorts of things.
Okay.
And that can you can have a modest impact or even a moderate impact with pelvic floor physical therapy, Kegel exercises, pelvic floor exercises, those sorts of things. But the vast majority of women who have a significant stress component to their incontinence will find that their biggest improvement comes from surgery. And that sounds really scary, but
it does.
Yeah, you think, oh, well, it's not bad enough for surgery, but the reality is most women can get almost a near cure from a 15-minute outpatient procedure that has a very low risk rate and a very high success rate.
All right, Dr. Sneed, you make it sound easy, but definitely something we should tackle.
Certainly.
And not live with.
No, you do not have to live with.